Hello everybody and welcome to lecture 2.1 for module 2 in RAD104, and we are still discussing pharmacology. So we're going to be talking about more drug classifications, so let's get started. So drugs are legally classified either as prescription or non-prescription. So non-prescription are the drugs that you can find at your CVS. You can, get it over the counter. Sometimes they're called OTC drugs or over-the-counter drugs. And then you've got prescription drugs, which of course require your doctor or someone else who has legal ability to order prescription drugs. You have to have that script, that piece of paper that shows that a medical professional knows that you're trying to obtain this type of drug, and therefore they are authorizing you to obtain that. So prescription drugs require the following, okay? They need the name of the patient, the name of the drug, and the amount of that drug that the patient's going to be taking. So those things have to be on the document. Now, does a prescription have to be on a prescription pad? Has to be on a specific piece of paper? Not really. Nope. As long as you've got the name of the patient, the name of the drug, and the dose regimen to be followed, then it is a legal document and should be allowing you to obtain that medication. Now, most prescriptions have to be dispensed by a pharmacist. However, sometimes doctors' offices will have samples or will have some of that medication in their office if it's something that's often prescribed. The other legal classification is non-prescription drugs, otherwise known as over-the-counter drugs or OTC drugs. And these are the things that you can buy, such as Tylenol, Advil, Motrin, NyQuil, Pepto-Bismol. You just find it on the shelf, you bring it to the cashier, and you can purchase it and bring it home. You don't need a prescription for that. So that's pretty easy enough. Now keep in mind, because I have seen this on some registry review questions, that vitamin supplements and herbal remedies are considered dietary supplements. They're not drugs. And because of that, there's no proof. There's no way to tell the efficacy of those products or the safety of those products. So it's just something to think of or keep in the back of your mind when you're dealing with some type of pharmacology question on the registry. So those are your legal classifications: prescription, non-prescription, and that vitamin supplement and herbal remedies are not drugs. They're dietary supplements, and so therefore they're not regulated or controlled by the FDA. Another way to look at pharmaceuticals is how the dose form. In what way do we have them administered into our body? So there are capsules, there are tablets, there are solutions, suspensions, there are patches, there are suppositories. There's different ways to put medication into different vehicles in order for them to get into our body to do their work. And oftentimes, some form of a drug can be put into different dose forms. So we know that Tylenol comes in capsules, they come in tablets, they come in enteric-coated caplets. So there's different ways to administer the drug as well. Look at nitroglycerin. Nitroglycerin can either be a tablet or it can be a transdermal patch. So once again, you can use different types of dose forms to administer it to a patient, depending on the patient condition and what they're able to tolerate. The first dose form I want to talk about is a tablet. Now, a tablet is it's a granulated drug, so it's a powder, and then we, basically squish it together and make a pill out of it. So that is, it's your basic compounding of making a drug. The person takes it by mouth, they take some water, they wash it down, it goes into the gut where it will be dissolved and then put into the bloodstream, and then it's able to do its work. So these are generally, hard discs. If you see a scoring on a tablet, that means that you are able to break it into different sections depending on where the scoring is, which is good. If you do not see scoring on a tablet, that means you probably should not be breaking it apart. So something to think about when looking at your medication. And so those are tablets. Real basic, easy, cheap way to make a drug and to get it into the body. Now, sometimes tablets can be a little bit abrasive to the lining of your gut or your stomach. So to help with that, they have an enteric-coated tablet. So it's really a tablet with a specialized coating that helps with, it minimizes the irritation of the stomach. Now, sometimes you can see this. I know that Advil, if you take Advil, I'm trying to think. I've seen Tylenol with an enteric coating. It's usually kind of a shiny, slippery coating. Not really slippery, but it's shiny. And that enteric coating, like I said, will kind of be a little bit more friendly to the lining of the gut. The only issue with that is that it's going to delay the release of that drug. So if you've got this migraine or you've got a bad headache and you want to feel the effects of that drug as soon as possible, an enteric coated tablet is just going to take a little bit longer than just your plain tablet. So something to think about. Another thing that we can do with this enteric coating is make it thick enough or have it dissolve later on down the road. So in other words, the release of that drug into the bloodstream will not happen necessarily in the stomach, but that enteric coating will last all the way until it's in the small intestine, where it will finally break down, and then the drug will be absorbed by the lining of the gut and into the bloodstream. And with that, that kind of gets into something called a sustained release, an extended release, or a controlled release of that tablet. So again, what we're doing is we're timing how long it takes for the body to break down that coating, and therefore you'll have this extended release or a controlled release. I saw a Tylenol ad the other day where they said they drilled tiny laser holes into it. You know, it's just delaying, or it's causing the release of the drug to be kind of a long extended period of time of when that drug is released, rather than having it all absorbed all at once in the stomach and you feel the effects right away. So it depends on what your goal is with that drug, and do you want to have long-term pain relief for a long period of time, or do you have one of those severe headaches where you just want to have it go away as soon as possible? So, you know, with that, it just gives us another kind of tool in the tool belt as far as how we want that drug to be played out, or how long the effects how long we want that effect to last, depending on the coating and the kind of coating that we put on that on a tablet. Now, the opposite of that is that you can have it disintegrate rapidly on the tongue or sublingual underneath the tongue. Something like a nitroglycerin isn't anything that we necessarily swallow. We put it into our mouth. The mouth and the saliva within our mouth break down the drug. It's absorbed directly into the bloodstream, right in the mucosa of our mouth, and so you've got this instantaneous effect. Again, nitroglycerin is a perfect example of that. So yes, some drugs are made to just be placed in the mouth. The drug is absorbed right through the mucosa of the mouth into the bloodstream, and you feel the effects very quickly. All right, kind of along the same lines, you have a capsule. There is a capsule, which is a gelatin type of coating. Inside that gelatin coating is the drug itself, whether it be a powdery substance or it be, I don't know, little granules, however the drug is formed. But that capsule or that gelatin, we know, will last so long in the mucosa of the stomach. It makes it very easy for these types of pills to be swallowed if you've ever had a gelatin capsule. It doesn't take long for that gelatin capsule to dissolve, but it's also slippery. As soon as it becomes wet, it becomes very slippery, so it's very easy for someone to swallow that down. And that's going to kind of take all of the different pill forms that you could find. So there's tablets, there's enteric coated, you could have extended release, you could also have tablets that are dissolved quickly within the mouth. You've got capsules with a gelatin capsule, which allows for it to easily be swallowed. So those are your different forms of kind of oral medication that you can get down into your stomach or dissolve in your mouth. All right, inhalants, different kind of dose form. This is a dose form that you would breathe in to feel the effect of that drug. The two examples I can think of with this include the kids or the people who have trouble with asthma. Perhaps they're outside playing a sport and they're having trouble breathing. They have an albuterol inhaler. They take a couple puffs of that, some shots in, they breathe in, and it's a bronchodilator, and they have an easier time taking in their oxygen, taking in their air. So that is an example of an inhalant. So that little puffer, that thing that they breathe in. One example. The other example is before a person is put out for surgery, you might see, or if you're setting up your C-arm before the case really begins, you see that the anesthesiologist might have a mask on top of the person's mouth, and they ask them to breathe in deeply a couple times, and within that second breath in, they are already knocked out cold. So anesthesia is often in the form of an inhalant, and when that person breathes it in, they are put out. That paralytic effect happens and they are out. And so those are examples of inhalants. All right, there are suppository forms. Now you might think that, this is one that you're probably not too familiar with, but if you get any type of medication near the mucosa of your gut, and that includes your mouth and that includes your rectum, it's going to be absorbed into the body's bloodstream. So a suppository is used for someone who might not be able to swallow well. Maybe they have an issue with aspiration. Maybe there is some type of paralysis or some type of function issue with their swallowing mechanism. If you wanted to get a medication into a person very, very quickly, using a suppository is the way to go. So you could use the rectum, you can use the vagina, you can even use the urethra. But obviously the rectum is going to be the way to go most of the time when a suppository is going to be utilized. It does have a very quick effect. So the drug, it does not take long for that drug to get into the bloodstream and to have an effect. So you should be aware that yes, suppositories are a form of administering a dose to any patient. All right, I know I'm pushing time, but I want to finish. I've only got 3 left to go. So solution. A solution is a drug in which one or more drugs are dissolved in a liquid carrier, okay? Any type of injection, okay? Injection is considered a parenteral administration, okay? So whenever you hear I got a shot, they got a parenteral administration of a drug. Solutions can also be taken orally, so you can drink them. So, cough syrup or anything like that is considered a solution. So when you have dissolved particles within some type of liquid medium, liquid carrier, that is considered a solution. So that includes oral medication and anything with a shot, again, called parenteral. We're going to talk more about that later on. Those are solutions. Similar to a solution is a suspension. A suspension is where you have particles suspended within a liquid medium or a liquid carrier. Barium sulfate is a suspension. That is on the registry. Mark it down. It's going to be on my test. Barium sulfate, the stuff that you give during upper GI exams, is a suspension, not a solution. The difference is this. If you took a suspension, if you took your barium, you shook it, and then you sat it on a shelf for a day or two, the heavier components would fall to the bottom and that liquid medium would be seen on top. If I have a solution drug and I shake it and I put it on the shelf and after a day or two, there is no separation. It is completely dissolved within the liquid medium. So barium sulfate, that's a suspension, okay? Suspension drugs should never be administered intravenously. They should never be administered parenterally, okay? They're almost always taken orally, okay? Rectally as well. So if we do a barium enema, that again is barium, it's a suspension. We're going to shake it up. We're going to put it into the person's large bowel. It's going to be drained out. But we would never put this type of dose form, a suspension, into someone's vein or vasculature. All right, finally, the last dose form I want to talk to you about is a transdermal patch. So these are drugs that are put on basically a sticker, okay, and that sticker is put onto your skin, and then that medication that's on the underside of that sticker is going to be absorbed through the skin, make its way into the bloodstream, where that drug will be administered throughout the body. Patches are great for allowing a drug to be given gradually over time. So transdermal patches are seen for people with nicotine addiction. They're also seen for people who need nitroglycerin kind of more often than not. So that's why they have a patch rather than taking a pill. So you can find transdermal patches usually on the upper arm, sometimes on the chest. Depends on what the medication is. Whenever you see somebody with a patch, again, if it's a nitroglycerin patch, stay away from it. You definitely want to have gloves, because if you touch it or around it and you get some on your finger, it'll give you a splitting headache. So just be careful of that. And I do just want to mention, for those of you interested in MRI, transdermal patches usually have a metal backing to them. And that could be a contraindication of using it during an MRI exam. So you want to be careful with that. I'm sure you would have to ask somebody during the screening process if they have any type of transdermal patches on. So that's it. All right, guys, those are the dose forms you need to know. It shouldn't be too difficult to understand this material, but if you do have questions, please let me know. We're going to continue on talking about more pharmacology. We're going to talk about the different routes of administration for drugs coming up, and I'll see you at that video. Take care. Bye.